Hi everyone, you're welcome to my channel. Today, I will take you through caffeine pills, otherwise known as caffeine tablets. You're familiar with that, so it's not a strange topic. So, without further ado, let's go. By way of introduction, caffeine is well known to everybody, so there's no need to waste your time on that. But to those who are coming for the first time, caffeine is a stimulant in the central nervous system. It helps you to focus and gives you energy. There are other uses of caffeine. I'll go through that here. Sources of caffeine, I'll go through that. Also, possible side effects will all be addressed here. Now, this is just to let you know that my focus will be on caffeine tablets, not the brewed coffee that you drink. So this is what 365 Microsoft could give me to represent the tablet. It could come under different brand names. Noodle, Stay Awake, Vivarin, Caffeine, or Caffeine. Now, depending on the brand that's available in your jurisdiction or country. Caffeine tablet will appear under just one form, that is the form of tablet. But each product contains different amount of caffeine. So, be pretty careful, check the package, and read instructions very well. Each tablet could be 100 milligram or 200 milligram, but the maximum dose that's expected in a day is 400 milligram. You are not expected to be taking caffeine tablets every day of your life. So, it's meant to be taken for a purpose within, a specified period of time. Administration. You can give caffeine tablets with food or without food, but never administer caffeine pills or tablets in anyone less than 12 years. And like I said just now a while ago, it's meant for occasional use only. Never give caffeine close to the hour of sleep. Why that? You'll know in a bit. Still on administration, there is that likelihood of either inadvertently or deliberately, if there's an overdose, then the individual will experience the following. There could be loss of consciousness, there may be coma. So I started with the big ones. Then there may be tremor, or they'll just shaky, jittery. And some individuals with overdose can have seizures. Of course, the blood pressure will shoot up, and the heart rate will also go up. In fact, there may be abnormal heart rate, known as arrhythmia. Drug-drug interaction. With those who are familiar with all my presentations, I usually leave this to the pharmacist and clinical pharmacologist. But for caffeine pills, I will quickly go through this. That grapefruit juice would decrease the metabolism of caffeine pills, and that will lead to the increased effect of the caffeine. So, don't drink grapefruit juice while taking caffeine pills. Also, briefly, I will take you through some medications like cimetidine, ketoconazole will also inhibit the metabolism, making the effects will be more. But phenobarb, phenytoin, and the likes like that can metabolize caffeine pretty fast and then reduce the effects. Also, because of its effects on the heart rate and so on, medications like salbutamol, formoterol will lead to more of the heart rate and tremor. Just like aminophylline and theophylline can also have effect, even cold meds. But I will leave the rest to your clinical pharmacologist or your pharmacist to guide you through. Now, sources of caffeine could be natural or synthetic. You can obtain it from coffee or tea. Also in energy drinks, energy bars, cereals, or chocolate. As a matter of fact, energy drinks, energy bars, and soda, these three are of concern to some physicians as per the use by the pediatric age group. As a matter of fact, someone FDA to set a guideline on the use of energy drinks, energy bars in pediatric age group. Still on sources, you can get it in cola. In some parts of the world, the cola, right? Hot chocolate, black or green tea, supplements, guarana, espresso, or certain medications like Excedrin of various brands, Azaprine and Levacet to mention a few. Now, uses of caffeine pills or caffeine tablets. Let me first of all address the illegal use. We know everything should be done moderately, right? You are fine. It is okay if it is at a moderate level. But you could become dependent on it or form habit of taking the pills if you go beyond that moderate level. In athletic performance enhancement, well, it could become a big problem if you are competing with someone. Like, you may be disqualified or you'll be in serious trouble if you use about 500 milligrams or 6 to 8 cups of brewed coffee at about 2 to 3 hours before the onset of your competition. Because when your urine sample is taken and tested, it's going to show there that you are using it as performance enhancer and you'll be in trouble. Still on uses, when it comes to pregnancy, I would advise, no, don't take it. Well, let me explain further. We don't need the increased blood pressure or increased heart rate or increased urinary frequency that may lead to dehydration in a pregnant woman. Okay? Also, remember, it can cross the placenta. And when that is the case, it's going to reach the fetus in the mother. And the fetus is not having the capability to metabolize caffeine. And you know what that means. When the woman could not sleep, the fetus won't, right? To avoid all the negative impressions or assumptions about pregnancy and caffeine, why not just avoid it altogether? Just forget about it, right? But if you must use it, then go very, very low. Don't go beyond 100 milligrams a day. Some authorities will say 200 milligrams, but personally, I would suggest don't take it. But if you must take it, maximum 100 milligrams. However, you can discuss further with your pharmacist. Other uses will include central nervous system stimulant, helpful in attention deficit and hyperactive disorder. In individuals with hypotension, depending on the cause, it can increase the blood pressure. In depression, could be helpful. Now, note this. Very helpful in relieving tension and migraine headache. That is when it is used at less frequency or at moderate dose. But the good work of decreasing attacks of migraine and tension headache at that lower dosage will be overpowered when you use it more frequently or when you use higher doses. Because at more frequency or higher doses, you are likely going to be treated to more headache. It can improve asthmatic problems and helpful in apnea of prematurity. In drowsiness, caffeine tablets could be helpful. Still on uses, it improves the memory. It can keep you awake or at least keep you alert mentally. You can remain focused when you take caffeine pills. It will not likely help you to gain weight, but you could see that I put a lot of question marks here because it depends on so many factors that can alter your weight. Okay? There will be less pain and feeling of fatigue if you are on caffeine pills because there will be increased muscle strength. There will be improvement in movement when it comes to Parkinson's disease, and that it is an excellent exfoliator and could protect the skin from damage by free radicals. You have to reduce the dose of caffeine tablets, or you don't use the caffeine tablet at all under certain situations. Like you are sensitive to caffeine, then why do you want to take it? So don't. In pregnancy, I've just gone through that. My personal advice would be don't. But if you must take it, you go for the lowest dose possible. Even with that, have that conversation with your physician or pharmacist. Breastfeeding? No. You are hypertensive? No. You have heart diseases? Don't take it. You have GERD? Don't take it. You are a child or adolescent? I would advise against it. You have insomnia? No. Peptic ulcer disease? No. Seizures disorders? No. You have liver disease? No. Thyroid disease? No. When it comes to diabetes mellitus, it might be controversial. Some authorities will say no, some will say, yeah, it is actually beneficial. So I'm not going to go into the details of that right now because there's a separate presentation on the relationship between diabetes mellitus and caffeine. The panic attacks, you are going to make it worse for yourself if you are taking caffeine. Kidney disease, no. Colitis, no. Regular migraine, don't use it. Advantages of the tablets over the brewed coffee. You'll be able to avoid the taste, and then there'll be less need to void, particularly if you are the type that your nature of job will not permit you or will not let you have the freedom of going to void more frequently, like drivers, police officers, pilots, and so on. So if you think you still need coffee and you belong to the profession where you cannot just be excusing yourself to go and void all the time, then caffeine pills will be appropriate for you. If you're a concert performer and you don't want to be leaving the stage, you understand what I'm trying to say, so you can make use of the pill. Then if your goal is less cholesterol, it has less cholesterol compared to the brewed coffee. So tablets will have less cholesterol compared to brewed coffee. However, the brewed coffee will have more antioxidants than the tablets. You could see, one is better in one way, the other one is better in the other way. Now, side effects. Increased heart rate, increased blood pressure, arrhythmia, allergic reactions, bloody dark stools. That is, the individual on caffeine pills for a long time can come down with clotting issues. And the reason is that caffeine might slow blood clotting. There may be heartburn. GERD could become worsening with time, maybe nervousness, dizziness, dyspnea, headache. Remember, it's helpful in relieving tension and migraine headache, particularly when you add caffeine to Tylenol 1 or Tylenol 2, then you get a positive response. But if you put caffeine tablets, high dose, and you are giving in more frequently, in fact, that will lead to analgesic-induced headache on its own. Nausea, you can become thirsty, and why that? When you take caffeine, you're going to void more, and when you lose water more, you become thirsty because you become dehydrated. Sleep problems or insomnia. I will go over this later on, so don't let me waste your time here right now. Disorientation, urinary retention or urinary frequency, more of the frequency, loss of appetite. Might be the reason why many will not gain weight. Seizures, particularly in high dose or overdose. Bleeding or bruising, because I said earlier that caffeine might slow blood clotting. It can be shaky or jittery. Anxiety will be on the rise, and there may be idiosyncrasy. Idiosyncrasy is simply saying medically right now that an individual could react in a peculiar way to any chemical, but this time medications, in such a way that is not common to the general public. Now, finally, still on side effects, now let me talk more about the sleep problem. You can become sleepy with excess caffeine. And why that? The adenosine receptors can be blocked when you take the caffeine at a very high level. So with that, I've come to the end of this presentation as per caffeine pills. It's good, it's helpful, but let's take note of certain situations, certain conditions, so that while trying to help that man or woman, we will not teach him or her into more problems. Thanks for listening. Please remember to share this. Remember to subscribe to my channel. I appreciate it.